Welcome to the Dog Dave Show. Today I'm so pleased I've got Susan Samimi on the show. And today we're talking about acne, in particular acne vulgaris. Acne vulgaris is quite a disabling condition. There is research which is quite widely known that 80% of the teenagers, they get acne at some point in their life, even the middle-aged people as well. So it can be disabling in the sense that cosmetically you got all these pimples looking on your face, rashes on your face, neck and back. It can be disabling in that sense. So there is categorization of this condition for middle, moderate and severe acne. If it's mild acne, it can be treated by topical, by creams you can just buy over the counter. And most of the times you don't need anything else. But in some cases, when it's moderate and severe, you need the doctor to see you and maybe commence treatment. The reason why it needs to be treated is because ultimately, in the long run, you can get scarring, and the scarring is permanent. And that is where the problem is. So you need some help. And to help me talk about acne today is Susan Samimi. Susan Samimi, welcome to the show.
Thank you very much, Dr. Dave. Thank you for inviting me.
You are a compounding pharmacist and cosmetic chemist.
That's right.
Yes, you do wonderful things with this condition. You've got so much experience.
That's right.
You did your pharmacy training, and then you further on did several courses. You just tell me off the camera that you've done many courses, and you've got passion in skin conditions as well as wellness therapies. Let's talk today about acne, which is quite a disabling condition for teenagers.
Sure.
Yes.
Sure. You're right. As you said, 80 to 85% of teenagers go through this condition. It can affect the adult as well.
Yes.
And it has a big impact on their self-esteem and also their well-being, their mood. And it can actually, I've seen some of the young people really affected their mental alertness, like mental health, not being happy, not performing well in school, or even their social life as well being affecting. And to the extent that even, employment, so you can sort of see it's such a big, huge thing affecting anyone with acne. I do see lots of young people, high school kids from age of, say, usually from 12 to 18 years old. I see quite a lot. And as you mentioned, acne can be mild, can be moderate, can be severe, like acne vulgaris is very severe. So the mild and moderate, sometimes the patient go to the pharmacy, they use benzoyl peroxide, they use a lot of different things, they're a bit desperate, they use a lot of different things. So I do see patients who are having mild to severe acne, and especially those who actually tried everything and they haven't had much success, then they come to me, either by word of mouth, or sometimes I get some doctors, they have seen a good result, they refer. So even with mild and moderate, some people respond, some people don't. And I found that sometimes they overdo with things. Like, they may be just washing their face 2-3 times a day to get rid of the oil. And then that is affecting them negatively, as you know. And then they go for benzoyl peroxide. They think that if they use high strength, it's going to work better for them. And actually, they get irritation of the skin, redness, and they give up. So, and sometimes I found them they're using wrong product. Like when the skin is a bit tender, the skin is like got pustules, they're going to use this scrub with granules, which I don't recommend it at all. So if they're mild, I look at the skin. If they're mild, I usually have a couple of products which I have formulated. And then in my formulation, like I use like non-comedogenic ingredients there. And I use also a few things like I've got this product called Niso AC cream. So when you look at it, the ingredient, it contains linoleic acid, which can help to dissolve some of those pustules and inflammation. So these are good for mild, like very mild. And then I did a toner, which is, I call it a Niso calming toner, which has got a lot of ingredients for hydration, like it's got sodium hyaluronate.
So talking about your product, so Niso, that's your company, isn't it?
Niso is our brand name, and also we are actually doing Niso customized solution to any of these issues, problem.
So people can get on your website, is that right? And
that's right.
They can see some of the products?
They can go to our website, that's www.niso.com.au.
That's right.
And also we have got a Facebook. And So with this calming toner I was talking about, it has got like ingredients like zinc, it's got a sodium hyaluronate, it's got a few different vitamins there which can help to calm down the skin.
Yes.
So for them to use these couple of ingredients, couple of products, is sufficient to really overcome the mild acne or help to control it.
Yes.
But when it comes to moderate and severe acne, I like to assess the patient. And I usually get them to come in. I'll give them some questionnaire to answer me, to sort of get a bit of history, what they have used, what was the response they had. And sometimes they have got allergy to something, like
Yes.
few of them come and say, oh, I don't like to use benzoyl peroxide. It gave my skin so much irritation.
Yes.
So then looking at what they have done, then I guide them with their diet as well. I found that sometimes you just hear that diet doesn't make any difference, but I have seen a great result that when they avoid certain food, especially sugar, and because the skin becomes more acidic, and when it is acidic means that more bacterial growth.
That's
and
right.
the other thing I've seen in young boys, the way they shave their face, they're using blade and they don't using a good hygiene. So
Yeah.
sometimes
We do this all the time. So what do you tell them? Which way?
I usually suggest to them to go, because I'm not expert in this area. I
Yeah.
send them to some shops where they are doing, especially selling the blades and stuff like that. So I'll ask them to go there and get their opinion which one is the best one for
Yes.
them, and so they can use it and also clean the blade and change the blade, because otherwise they're spreading. So I found that was helpful. The other thing, as I mentioned, I do lots of customization. So I can sort of say, for each person, I might be doing different things. So
Okay.
sometimes I start them maybe with antibacterial wash. And if I use antibacterial wash, I actually go with the wash, I make it myself. No foam. I don't like foam because it has drying effect and it also damages the skin. So then I use maybe chlorhexidine with that. I found it great. They can sometimes use it after shave and before shaving, and I had a great result with just simple doing that cleanser and using this product, which is for mild to moderate.
Right.
We get a great result with that.
Yeah. So look at your products now. Are these usable for all types of skins, for instance? Do you use them on all types of skins?
I do have some, like, I didn't bring them here, but I do have few products where people can use it, like if you've got normal to dry skin. But anyone who has got allergy reaction, who's got acne or rosacea or hyperpigmentation, I usually like to suggest to them what is best for them. If there is something already got it ready-made, I recommend that. Otherwise, I'm not limited. I actually make things especially for that client.
Yes. No, looking at the actual making process, the chemistry part of it, how do you calculate your numbers to say this is for acne or this is for some other condition? How do you come with a calculation? Is there a formula or books you follow or something like that to make your products?
Of course, with lots of research I've done before to see what ingredient helps what.
Yeah.
And so like in this one, I put that in, like linoleic acid to reduce the inflammation. If I'm doing for like this young man.
We're going to show him shortly,
Yeah.
yes.
So like I've treated few people with different things, but like I might use vitamin B3, I might use retinol cream, I might use vitamin C ester, I might use different ingredient to help. Yes. So of course the knowledge is there that how each ingredient works, because being a cosmetic chemist, then you actually know how each ingredient works. And being pharmacist and being working in this area for a long time, I can actually recognize what is, the problem is. If something I don't know, I will refer them back to the doctor and let the doctor have a look and check. So I do work very closely with doctors as well.
Doctors, yeah, that's good. So you get referrals from the doctors as well?
I do get some referral from doctors, and I work with doctors. Like if someone has got acne vulgaris, they do need to get antibiotic. They need to be treated with topical, maybe even oral antibiotic.
Yes, that's
so I leave that entirely with the doctor to decide and just prescribe. And sometimes they prescribe antibiotic topical, but they send the script to me, but I use different bases. Okay. So that makes a difference with effects on the skin. So and sometimes maybe something a bit stronger than what is in commercially available. And then the base I do makes a big difference in each person, because everyone has got different skin.
That's right.
So everyone need is different. So accordingly, I make that base for each person.
Do you find that acne in your area, is it more popular in the males or women? What's the popularity?
I do see both. I see lots of young boys and young girls. I do see a few mature people, like the age of like late 30s, 40s as well. And so a lot of them are high school kids I see. So really equal, boys and girls.
Yeah, so, I mean, they come to me as a family physician, they come to me, you do the assessment like you are saying, you educate them. It's about education as well in terms of skin care. And also knowing what is acne, how does it come about? You know, about the hair follicles and some dead skin building up the hair follicle, and you got infections. You have to educate them, otherwise they won't be compliant with the treatment. And sometimes we have to give creams, take in the night or take twice a day or something for maybe a few weeks. Because this condition doesn't go like quickly. It may take months on antibiotics, like you're saying. You give some doxycycline, minocycline, or something like that for months. Then we consider other things. Royal oxygen, vitamin A, if it's quite disabling and it's not, it's unrelenting to some of the common therapies we give, we try that. And yes, we also refer to a dermatologist, but that you are coming in to helping us treating the condition is quite a worthwhile recommendation. And we appreciate what you do regarding treatment of acne, as well as looking at the internal part of it. You're saying you look at the wellness, you look at the change of diet and maybe lifestyle changes in treating the condition. It's not just the skin, it's also what's happening inside. Like we look at the hormone type of hormonal changes in the teenagers, and now in females, we put them under contraceptive pills, again, to balance up the hormones and all this stuff. So, and we may have to check for other conditions that can cause acne, let's say in particular in women. We check for polycystic ovarian disease, again, so we're looking around, it's not just the skin, we're looking around, eliminating other things, yes. So you said you got some pictures to show us.
That's right.
We'll be glad.
On that point, when actually I do assessment, you're right, education. I usually like to talk to the kids themselves and just get them to feel that they're responsible for their own skin, and they need to watch their diet, they need to have a good home care hygiene on for their skin. Yes. And I found that when I actually have that one-to-one discussion with them, they really try to follow and then do their best, and they are very successful.
That's right.
And education is the key, definitely.
Is the key, you see. Yeah, it's sad. Sometimes I see some of the my patients, they come later on in life, you know, they got all these scars on their faces, on the back and chest, because severe acne, which wasn't treated in the past.
That's right.
And now those scars are permanent. And now the only way we can go around maybe treating these scars, and now we're going to laser therapy, which is my topic. We're going to talk about laser therapy at some point regarding acne. So we go for laser therapy and all chemical peeling and all the stuff, you know, regenerative medicine, basically. But if we treat it early, we recognize it and treat it early. That's the key. We treat it early. That's right. We will avoid these complications of scarring. That's what we're talking about. And in a general note, we say, don't pick the things. Don't pick them.
That's right.
Those pimples or whatever you call them, don't pick them. But the more you pick them, the higher the risk of getting scars. And then the scars are permanent. Then you have to deal with them. If you're a lady, it's a difficult situation. And again, covering, if you got acne, covering with makeups. What do you think of that?
Definitely. With the ladies, with the young girls, I suggest to them not to use a makeup with a foundation which has got oil base. I really like to use the mineral makeup maybe, which is more powder.
Right.
And then I do suggest them to use a toner, like this toner is great to use it underneath.
Yes.
So I guide them with that as well, because they sometimes put such a heavy makeup, and then because they already have got maybe open blackhead or whitehead,
Yes.
and that can actually cause lots of
Yes, you worsen up the
infection.
situation.
That's right.
Yes, because then you are trapping in all this debris, and the makeup goes in the hair follicle, and it becomes a big environment for the bacteria to go in. It just compounds the situation. So we say minimize usage of makeup, and definitely talking to you, you'll be able to guide them how to use their makeup. Okay, so you're going to show us your one case. You brought the pictures here, the befores and afters. Do you mind talking us through the pictures?
Sure.
Yes.
So this young man is 17 years old, and he had the acne for quite a while, like maybe when he was 15 years old. And he was on oral antibiotic, and he tried everything in the market. And he was really depressed. He was not happy at all.
Yes.
He couldn't do much with the school. The parents were very concerned. So the parents, the one, actually encouraged him to come and see me. And when I saw him in this picture, he had actually lots of pustule and cystic acne. And then with his doctor, we worked together, and he prescribed some antibiotics. So first thing we did, he actually only gave topical antibiotic in his case, because they were considering to actually suggest Roaccutane for him, but the parents decided first to give it another chance. If it doesn't work, then they'll go that way. And so the doctor prescribed the antibiotic, of course, a bit higher dose than what is in the market, maybe 3 times a stronger dose. And I did a special base for him to settle down the pustule and inflammation first. So his first photo is not there, but the one you see, the first photo, that one, is actually after we had the antibiotic done, and you can see the inflammation is a bit settled. And when he got to that stage, then I started working on his scarring. So in his case, because it was severe, I decided to work from inside, as I was mentioning. As you know, when they're going through puberty, their hormonal changes happens, and the testosterone can go to dihydroxytestosterone, and that can cause a lot of issue. So, and the 5-alpha reductase is the one to blame. So what I tried to do a special supplement for him to block those pathway, and also use ingredient which can also help the healing of the like acne and sores. Plus, like when you're looking at his blood test, then I could sort of see the level of zinc and copper and other vitamins. So I tried to balance him with that. So I gave him those vitamins to take morning and night, and then I did make him also like a special antibacterial wash. Then second time I changed to like AHA, BHA wash maybe. And then I did make for him, like he did use these ones, the AC cream, his AC cream during the day. And he was using his antibiotic at night on the skin. And then after like the second photo you see, then I actually also did some cream for him to use at night, but I use also collagen boosting ingredients for the daytime. So because being young, they can respond very well. So you can sort of see in third photo, all the scarring gone. And because,
that's amazing, isn't it?
That's right, because we helped him from internally to take those vitamins to heal, and then also using cream which could help the collagen boosting and then overcome. So you will think that he might have done quite a different treatment, but it was all to do with ingredients.
Wow.
So I found that the power of ingredients, if you use the right ingredients, you get an excellent result. He was very happy, I know that, when he went to the doctor.
Well, that's quite a big difference from the first one to the last one, definitely. How long did it take him to have the treatment?
About 4 months.
4 months there,
yes.
okay. All right.
So from that stage to that 4 months it has taken, and now it's almost a year gone, and I saw his mom last week, and she just came to get this one, like the mild one, as a maintenance.
So maintenance.
And he's doing very well, so the skin is pretty good.
So maintenance every day?
He's not, being a boy, they don't follow the
Is it
instruction
supposed to-
all the time.
Yeah,
but
is it supposed
he's
to
doing
use
well.
every day? Yeah, is
Yes,
it?
every
Yeah.
day, like they can use it morning and night.
And for how long will that be?
They can just do it. This is nothing they're medicated, so they can use it. But I think he must be using once a day.
Yes, yeah.
That's
But I mean, for how long are you going to plan? Are you planning to?
It is
prescribe
it's like a normal moisturizer,
Oh, okay.
so he can use it. I think he's not very compliant all the time, but his skin looks still good.
Yeah, it does. Yeah.
And he still like try to remember to watch his diet. So he's doing a bit, but not as much. But
Yep.
he has improved a lot. But
Yep.
you know, when he gets a bit bad, he goes back to that diet.
That's right.
When I mentioned to him, yeah.
That's good. Yeah. Not many of you are doing this thing, isn't it? Cosmetic chemists in the whole country.
With to extent I'm doing like as I do like very much customized. I've written here your face cream. I really do for each individual. I don't know. There are not many people doing this
Yes, that's
really
right.
because I'm doing from scratch really
Yes.
if needed for anyone, and I'm not aware of anyone in North Queensland, but I think it's very few maybe doing something to this extent.
Yes, yes. Yeah, I like the idea that you got your own brand, you know, you're promoting your own brand, and you get a deluge of patients coming to you now.
Yeah, I at the moment promoting the customization.
Yep.
As we are different people, we've got different skin tone.
Correct,
So
yeah.
I think everyone's need is different.
Yes,
So I
yes.
found that when we are doing this, we're getting great result. Doesn't matter whether it is acne,
Yep.
whether it's rosacea, whether it's
Yes.
anti-aging.
Yes.
So we get a fantastic result.
You're doing well, Susan. Thank you so much. I appreciate that. Thank you so
Thank
much
you.
for coming to the show. And
Thank you for your time.
ladies
Thank
and gentlemen, thank you so much for joining us on the Dog Dave Show. I hope you've learned something. Keep safe, keep well, and God bless you. Bye-bye for now.
Thank you. Thank you.